think anyone working in the health service always views winter with a bit of trepidation. We have a very challenging situation at the best of times in Northern Ireland from the perspective of our health service, and when you add on the additional winter pressures that inevitably come every year, it does put the whole system under a huge amount of pressure, and we see that really acutely at the coalface here in general practice. So the extra funding, what it does is it creates a little bit of space and a little bit of extra resource to add in additional surgeries and additional sessions in GP practices up and down the country. There are a couple of issues with that. Number one, not all practices can utilise the funding because they can't necessarily always access additional help and support from GPs because there are fewer GPs around, and it's sometimes hard to get locum GPs into areas where it's hard to recruit. So that can be a challenge for some practices. And of course, there is always a huge issue with access anyway. So the amount of money that is provided every year to GPs, while it's welcome, is really a drop in the ocean when it comes down to the need that's out there in the community. So while we welcome it and utilise it, we could absolutely do with more funding if it were available. This time of the year, the demand for appointments just does escalate. There's no doubt about it. When you see sort of the winter viruses that are starting to take hold at the moment, and also just general ill health, we've got lots and lots of people who require our services every day of the week, whether they've got something acute or whether it's a chronic long-term condition. So we have a huge demand which we try to meet as best we can, like every other practice up and down the country, but we know that the capacity in general practice is not sufficient to meet the demand that's out there in our communities. There's certainly been an uptick in respiratory viruses right across our community here, and we've seen that through, I suppose, our day-to-day pressures in terms of requests for appointments and assessments, and there's a lot of information out there online on how to deal with those common conditions. But if you are an individual who's a wee bit more at risk or a bit more vulnerable, either because of your age or because of other conditions, it's often important to talk to a health professional, either a pharmacist or a GP, just to get some extra advice about how you're managing and the best things that you can do to help support your well-being and getting better from those kind of infections.